So we are doing butterfly sticks today. So this is a little different than drawing regular blood. Same steps as drawing blood, like as in introducing yourself and everything like that. So as you walk into the room, obviously we're not wearing our gloves yet, but I'm already pretty much set up. So you're introducing yourself. Hi, my name's Kayla. I'm here to draw your blood today. You verify their name, whether it's on a piece of paper or on their wristband, however it is that needs to be done. First, last name, date of birth. So once you've done that, you're gonna go ahead and sanitize your hands, put your gloves on. Then we're gonna go ahead and I always tie the tourniquet up on this part of the forearm because it has a little bit more meat there. If we tie it too far down to the wrist, it's gonna be uncomfortable, and then you might have some tourniquet interruption in the way with you know, wherever you're trying to draw. So I put it up here. It does the same exact thing. So go ahead and move your hand back for me. So what I do is I'll go ahead and take a look, and I'll grab their hand like this at first. So she has some really nice veins right away. And you can check on both sides. It's not 100% necessary, but you can. So if you don't find something on the first side, you'll go ahead and we'll check on the other side. And honestly, I think I actually might do it on that side. So that's the reason why we do that, especially for the hand veins, because it just is like hit and miss on the hand veins sometimes. So you always want to go in the fattest vein because it's just going to make your job a lot easier since we are going a little bit more surface wise on these veins. Okay, so she has a good vein over here, and so what we're going to do is concentric motions. Let's see. Actually, this one has a lot of connecting veins. No, we're gonna go back to the other side. I lied. It's okay. So that's why we always check on both sides. Okay. So you want to go on the flattest, not flattest, but the most straight vein, and you don't want to go in any connecting points because there could be valves there and it can hurt the patient. Okay. So I'm gonna go back on this side. She has a nice straight vein down from the middle. Always concentric motions, letting that dry really nice and air dry. Then when we take the tubing out, we want to yank on it because we don't want it to be curly or anything. It makes it a lot easier for handling. Then we make sure we twist that in, pushing down on this part so that this part doesn't come off either. Then we're grabbing our butterfly and we're pinching on the side that has the BD and 23 gauge and these little parts that go directly into each other. And that's how we're going in to the vein, okay? Always double check your needle. And then always anchor your vein the best to your ability, okay? I always try and anchor like with the finger over here and then pulling down as much as I possibly can just to make it as easy of a surface for me to go in. And then you see how I'm almost flat but not quite. Let's get this a little flatter. Okay, I'm not quite flat, but I'm almost at like a 10 to 15 degree angle because we want to make sure that we have somewhat of an angle to get in there. So here we go. And you see how her vein, okay, so I was right on top of it. Her vein went to the right a little bit. So what you're gonna do is pull back, push in, okay? That's just readjusting because most hand veins are gonna roll out of the way, okay? So I always try and have one hand on if the patient is sitting still. If not, sometimes you can just let go, depending on the patient's status that they're in. So holding one butterfly wing, then I try my best to, this is like the part that you need to learn, is learning how to switch your tubes out with one hand. So just gently slide it in there, push in, keeping this at a little bit of an angle. You can kind of let that sit there if you need to move this around, you know, lift the bevel up a little bit from the back to open it up if it's touching the top of the vein. So I pull that tourniquet tube, then we put the gauze, pull back, go ahead and hold for me. Immediately activate that safety. Then we're gonna toss it. And then same thing as before, we're inverting our tubes. Filling out first, last name, date of birth, military time, your initials, and if you have a code, you'll do that. Then grab your tape. Take a look in here. You're pretty good. So you want to give it like a good couple minutes. Like normally that takes like about 2 to 3 minutes. So that'll give it enough time to clot and be good so that you can let them go. Go ahead and hold that again for me. And that is it. And then you thank them and tell them to have a nice day. And that's it.